Hi, everybody. My name is Samantha Horwill, and I am Managing Director in Wales for an organisation called Practice Unbound. Practice Unbound is a not-for-profit social enterprise, and we exist with the purpose of creating distinct and vital shifts in primary care. We believe that the capacity to lead is within us all, and that the people needed to make the changes that the healthcare system needs are already working within it. Now, primary care is a term often used to describe the front door of the NHS. So your GP surgery, dentist, optometrist, community pharmacist. So if we could just take a moment to consider two questions. The first is, when was the last time you needed something from your GP practice? And then what did you notice about that experience? Welsh Government undertook their All Wales survey in 2018, and one of the statistics from that was that patients reported 42% of them found it difficult to get an appointment at a convenient time. Now, this is not a surprising statistic, considering the challenges that have become synonymous with delivering primary care in the UK. We know that there's a shortage of clinical staff, especially doctors. We know that there's a rising demand in patient need, and there's a lack of investment. And these really challenging conditions have an impact on the GPs themselves and their practice teams too. The Royal College of GPs in Wales did a survey in 2018, and 31% of GPs who responded said that at least once a week they felt unable to cope because they were so stressed. 31%. And 72% said that working in general practice was only going to get worse over the next 5 years. The work that we do is creating the conditions for change by delivering learning programs that try and give some time back to GPs, creating the gift of time for GPs. And one of the learning programs that we do is called Workflow. Now, Workflow had its genesis in a small GP practice that we run in Sussex. Now, our practice is not immune to all of those problems that I've just described. We struggle with all of those things too. But as an organisation, we create a culture of curiosity. We encourage people to try things, to test things out, and let them learn when things don't go quite as things have planned. So we believe that the people who are needed to make things better in primary care are exactly those same people who are actually working in those practices. The trick is to create the conditions so that those ideas can become a reality. So it happened that one of our GPs and one of our administrators sat down one day and said, how can we make this a little bit easier? How can we give our GPs the gift of time? And so when we looked at all of the jobs that the GP has to get through in a week, we spotted that document management might be something that we should investigate further. So document management is a term that's referred to when you want to describe the work that's involved in receiving, reading, recording, and actioning all the bits of paper and mail that comes into a practice every single day. And your GP will receive about 50 pieces of correspondence every single day. So that's 250 letters from hospitals, out-of-hours services, social care that will need to get read, added to your GP record, and then any actions taken. So bringing you in for a follow-up appointment or booking a blood test. And traditionally, that job will come down to your GP. They will have to do that work. And the GPs will tell you that this is the job that gets left till the end of the clinic. So often this will get done late at night or on the weekends. And they will confess that this is not their best work. So often the patient record will be out of date. just because of the delay of trying to plough through all of these letters. And so when we looked at this problem, it became apparent that there was a way of shifting some of this work to a suitably trained member of the practice team, and thereby freeing up the GP. And when we looked at all of these letters, we could group them into different letter types. Some that were telling us about an appointment that the patient missed, for example, at the hospital, or an interaction that the patient had had with an out-of-hours service. And what we noticed was that these letters could be grouped into 3 cohorts. A group of letters that actually, with a bit of support and guidance, an administrator could quite easily pick up that job. There was a group of letters that actually were a bit more complicated and would require a little bit more support. And then there was a group of letters that would ordinarily almost always have to go to the GP. So that part of the job would have to stay with the GP. And as we started to test and implement and try this new way of working, it became apparent that we were onto something. And that we discovered that up to 80% of those letters coming through could be managed in a different way and wasn't ending up in the GP's in tray. And not only that, what was really interesting was that this time saving wasn't equating to extra patient appointments. What it meant was that the GP was leaving the surgery at a reasonable time. They were putting their children to bed. They were having downtime on the weekends. And surprisingly, the administrators who were now doing this job were feeling far more job satisfaction. And in fact, the patient record was more accurate and the clinical coding was better. So all in all, this felt like a win-win. And within our practice, we thought that this was certainly an approach that was giving our GPs the gift of time. But then we had a question as an organisation: if this was working for us, would it work for someone else? And at this time, we were very fortunate to get some grant funding from the Prime Minister's Challenge Fund in England, and that enabled us to bring a wider group of practices into the fold to test out whether we could replicate these benefits. And what we noticed was that it did. So those practices that found the right person to do this job and then allowed that person the time and space to learn, to test, to experiment, and most importantly, a GP leader who would sit alongside that administrator and support them through that journey and also broker the relationship between the administrative team and their clinical colleagues so that everyone was doing the same thing. Those were the practices that were seeing the 80% of those letters being shifted away from the doctor. And it was at that point that Workflow as a learning program for primary care was born. Now, in April of 2016, NHS England published a document called the GP Forward View. And this paper set out a vision for primary care, and it also came with a very handy £2.6 million investment in primary care year on year until 2021. And within this document, it highlighted 10 high-impact actions. And one of those actions was something called productive workflows, which included an approach to document management. So for us as an organisation, the GP Forward View was the catalyst for our role nationally. And it wasn't long before we were inundated with inquiries from across England about our programme. And it wasn't long before we were delivering a 4-day training course to our first 200 practices. Now in Wales, at the time, Cwm Taf, University Health Board, approached us. In spite of the fact that there was no central funding available in Wales, they were interested in investing in this for their practices, and that was to be just the beginning of our relationship with the NHS in Wales. So we continued to develop this program and deliver it, but it wasn't long before we realized that we needed to go back to the drawing board. We needed to rethink the way that we were delivering the program. For one thing, taking a GP administrator out of practice for 4 days was not landing well. And indeed, we were also hearing that there was an increased desire from practices to be able to demonstrate the impact of this investment. And so as a result of that, in the summer of 2017, we relaunched the Workflow program as a blended learning approach. So what that meant was that largely all the technical skills that the administrators would have learnt in the 4-day course, those were delivered through online modules. And there was still an option to have some face-to-face interaction with us, but this was much more condensed. So 3 hours with practice managers and administrators and 2 hours with GPs. And what we also did was we helped GPs to use the data that they already hold in their clinical systems, but we helped them to see it and use it in a way that they could track their implementation and also demonstrate that the investment that they had made was making a difference. We also created a team of highly skilled coaches so that when we work with the practice, we are able to provide support for a period of 2 years. So it wasn't like attending the course for 4 days and that was it. We work with practices over a period to support their implementation. And so it happened that we were now a national player and that we weren't only working in England, where there was dedicated funding, but we were now able to deliver this program at a much greater scale across Scotland and indeed in Wales. So since that initial interaction with Cwmtaf, which is one health board in Wales, I stand here now and we are working with all 7 health boards across Wales. We have offered this program to 183 practices, which means that we're working with 40% of the population of Wales now. And that opportunity to work with GPs and their teams has meant that we've been able to develop relationships, and that is now opening up the opportunity to consider what contribution could we as a not-for-profit social enterprise make to the work that is required to save our very precious primary care services in Wales. And furthermore, nationally, we've looked to now build on what we've learned around workflow. So we are working with practices who wish to collaborate around this function. So you can imagine that it makes some sense that if practices all pooled their resources and created a network, they could do this function together to save money and make it more efficient. And we're also just on the cusp of launching a new program which creates the conditions where a non-clinical member of the team can manage up to 60% of pathology results. So yet again, another gift of time for our overstretched GPs. The workflow program has been offered now to over 2,000 practices across the UK, and we've saved 700,000 hours of GP time. And I am very proud of every single practice that has taken this journey with us and has implemented this program. This idea has been made possible because we created the conditions for people working in practices to be curious. We gave them permission to fail. And we created this culture where learning together is the way forward. And my advice to you, in whatever circumstance or industry you're working in, if you're grappling with a problem, look to the people who are in that problem, who are in the chaos, who are in the detail, because that's where the solution is waiting for you. Thank you.